Good afternoon, everybody. Welcome to our media briefing. We're happy that you joined us again for this time to give you an update on what's happening related to COVID-19 in Eau Claire County, and also to answer the questions that media has for us. We've been doing these updates for really a long time now, and we appreciate that you continue to join us to get information and updates related to what the current situation is in Eau Claire related to the pandemic. So thank you for that. Today is Thursday, March 11th. So we'll start as we usually do with our local data, a little bit of state data as well, and then a couple of updates that have happened since we were last together. I'll end with the questions that we got in advance. And if any of our media partners that are on our call have additional questions, please feel free to be entering those in now to the chat box so that Audrey can retrieve those and share those with us at the end. First of all, our Eau Claire data. We now are at 11,084 positive cases for COVID-19 of Eau Claire County residents. As you see, we are well over that 10,000 mark, which is about 10% of our population that has been COVID positive since the start of this pandemic. 81 additional cases since 7 days ago. So in the last 7 days, we've had 81 cases, an average of a little over 11 cases a day. Again, our goal continues to be, in order to manage cases effectively, to do the work that we need to do in our public health best practice, to have people isolate so they don't spread disease, and to have those close contacts stay home. In order to do that work, we really need to stay at 10 cases or below. But certainly our goal is to get this to a point where we have 10 cases or less a week. And we have a ways to go, but certainly considerably better than a number of months ago. So I will just note that really the state and Eau Claire and across the nation, we are seeing case numbers that are considerably better. I do want to also note that those of you that watch the daily case numbers have been seeing some odd variations in our case numbers moving forward this week. And I do want to note that in case that has happened as you've looked at our data page or at the state data page. First of all, we have started recently not having staff do case numbers where we pull down cases on Sundays. So our numbers on Monday will consistently be at 0 cases. So do note that as a reminder. Doesn't mean there were no positive cases on Sundays, it's just that they haven't entered into our system. We also have had across the state, our state epidemiology team has been going through and cleaning data from last fall. And during that cleaning process, they have been moving some of the cases that were previously in our case count as positive cases to our probable case count. We typically only report to you our case count, our actual case numbers from our PCR tests. Probable cases are antigen positive tests, and they are also cases, but the state and the CDC names those officially as probables. And for that reason, we don't have them in our case count in that same way. A probable case is an antigen positive. It's still a case that needs to isolate and quarantine and still spreads disease. So do know that those fluctuations are happening right now. You may have noticed we had a couple of days of negative case counts. It wasn't because we didn't have any cases during that time, but it is because they were cleaning cases from back in November and December. And certainly if people have questions about that, they can always call the health department and we can talk them through that. We have about 98 active cases right now of COVID-19. Again, a much smaller number than what we were seeing in November and December, so good news. Our hospitalized cases total since the start of the pandemic are now at 362, an increase of an additional 6 people that have been hospitalized this past week. And our case count remains for deaths remains at 105 Eau Claire County residents that have died related to COVID-19. The other Eau Claire data that we typically share with you, again, some basics. Our UW Eau Claire case count remains about 13% or so of our case numbers. UW Eau Claire continues to do testing on a fairly regular basis with their on-campus, off-campus students, as well as their faculty and staff. Our state rating for COVID-19 remains at the high level. That is a rating of looking at what is happening with COVID cases in every jurisdiction. The trajectory is shrinking this week, which is good news again. Again, we have a little ways to go until we get out of that high level, and we're hopeful that with ongoing mitigation strategies, us all continuing to practice those safer practices, we will soon get there. Our positivity rate is at 3.8%. Our testing numbers are down to 316 tests per day. Again, a trend that we're hoping does not continue to go downward. We need people to, if they need a test, to get a test. If people are choosing to engage in social activities that get them in closer contact, please get tested and make sure that you are keeping yourself safe and those around you safe. People that are asymptomatic can spread COVID-19, and that's really what we are trying to avoid happening in this community for the employer's sake, for those businesses you work for, as well as the kids in school and all other parts of our society. If we're testing and if we're following those basic mitigation strategies, we really have a lot of opportunity right now with the increasing volume of vaccine available to us. Our regional hospital bed space has been good. So we are in the green for inpatient beds, we're in the green for ICU beds, and we are all working hard so that we stay there. I think many people have been noticing some recent reports from other countries, like recently Brazil, who is seeing really large spikes in hospitalizations, and we don't want to be back there. So our goal continues to be that same goal of keeping case numbers low, keeping hospitalizations low. Community spread is at 34%. It is remaining in the red. It means that people are not knowing where they got COVID-19. We are getting to the majority of individuals that are identified as positive quickly within that first 24 hours. We're at 88%. And we have capacity to do that work right now, which is really a testimony to having lower case numbers. Again, if you would like to look more carefully at the data for both Eau Claire as well as surrounding counties and the state, please go to our website. There's a lot of local data there. You can also get the links to all of the state data resources. The state is making shifts in the kinds of data that they are sharing, and there is a lot of good state and local data available. The state status update, again, some just simple walkthrough of numbers, but we are now at 568,352 individuals in the state that have tested positive for COVID-19. Active cases are at almost 6,500 currently, and the state continues to be in that high activity level. 6,524 individuals have died related to COVID-19 in Wisconsin, an increase of 54 since last week, Thursday. Couple of announcements to share with you. First of all, National Guard testing, which we have had in place in Eau Claire for many months now, has ended as of this week. So our testing at the National Guard sites in Eau Claire, in the city of Eau Claire, as well as in Augusta, this was our last week of that testing. We are incredibly thankful to the National Guard for their service, for their willingness to work with us, as well as many other testing sites across Wisconsin. We are also very appreciative of the locations, Peace Church, as well as the Augusta Senior Center, that were willing to partner with us to make those National Guard testing sites a possibility. So thank you to that partnership. Do know that we want people tested. So we have good testing availability across Eau Claire County on every day of the week. Our healthcare providers are able to test, and we do have testing options that you can do at home. So go to our website. On the testing tab page, you can find out information about getting a test. We encourage people to consider getting the at-home vault test and having it at home for when they need it. That is something that you can access at our website and see how to make that link. But we also encourage you that if you have any symptoms, if you have been in close contact with anybody that is COVID positive or have been in close contact where you are uncertain about others' COVID-19 infectious status, to get tested. If you have questions, please note that you can always call our call center number. That's 715-831-7425. Recent announcements about eligible groups for vaccination came out today, so I'll walk through some of those updates as well as talk a little bit more about what's happening with vaccination in Eau Claire County. Certainly the important and really exciting news that is coming both for our community but across the state and nation related to vaccination. Today, the state announced that people over the age of 16 with certain medical conditions would be eligible for vaccination for COVID-19 beginning March 29th, so in a few weeks. This group is next in the priority list because some of these individuals with these conditions can result in higher risk for negative outcomes related to being positive with COVID-19. So those conditions are listed on the state website. And the goal, again, is to decrease the number of people that, if they are infected with COVID-19, that they have hospitalization or death. So vaccination, all 3 vaccine types that are available. The good, solid news that we have about all those vaccines is that they are equally effective against preventing death with COVID-19 infection. And that's really, really good news for both those over the age of 65, our current high priority eligible population, as well as those individuals that are under the age of 65 but have conditions that make them more at risk. Some of those conditions include cancer, heart disease, Down syndrome, a variety of issues related to diabetes and those conditions, type 1 and type 2 diabetes. Those people that are overweight or obese are also included on this list, as well as a number of other conditions. If you need more information, please do go to the state website. We will soon have updates on our website as well. This was just announced this afternoon. And those individuals are not currently eligible, but will be eligible after March 29th. We also want to share that that group is very large. So over 2 million people are estimated to be eligible in Wisconsin in the groups that are over the age of 16 with compromising health conditions. We know there are many people in those groups in Eau Claire as well. It'll take some time to get through those groups with the limited vaccine that we have available coming into Wisconsin. Please have some patience, even though we know people are eligible. It will take some time throughout the months of April and early May to get to all of those groups. The state did also announce today that they anticipate that the general public, everybody else, will be eligible to be vaccinated probably sometime in May, and we certainly will keep everyone informed about that as that is announced. Our community is doing really well with getting shots in arms, with getting vaccinations happening. And really a really big shout out to all of the vaccinators in Eau Claire County that are working hard to get that done. Not only is the health department providing mass vaccination clinics, but our healthcare providers, our pharmacies, UW Eau Claire, and others are vaccinating right now for COVID-19. And that partnership has created an incredibly powerful opportunity for people that are currently eligible to get a vaccine. We know that right now, our educator group and those over the age of 65 are the priority. Those are the ones that we are trying to make sure we get vaccinated in the last couple of weeks, and they will continue to be a priority per the state direction. We also know that there are many others eligible in this 1B group that was previously named on March 1st, and we are slowly getting through those individuals as well. So if you are currently eligible, there are opportunities to get vaccinated. Again, not enough, but we are slowly getting vaccine into Eau Claire to get that done. Continue to go to our website, look for those opportunities to find a vaccination appointment there. We encourage you to go to your healthcare provider if you are able to do that. There are also other locations like our health department clinic where there will be vaccine available. We'll get that information out as we have appointments scheduled. A reminder that those over the age of 65 are particularly targeted still. We know that we are doing well with that age group, but we still have individuals in Eau Claire County that are over the age of 65 that may be struggling to get vaccinated. If you are having a hard time getting an appointment, or you know someone that is having a hard time getting an appointment, please continue to try to reach out to your healthcare provider. They are all telling us that they want you to reach out and they want to get you in. Call the COVID hotline or the Aging and Disability Resource Center number if you need additional help in obtaining an appointment or accessing a vaccine appointment somewhere. If you are not sure if you're eligible, please again go to our COVID-19 eauclaire.org website. Click on the vaccine appointment tab that is right on that front page, and that will walk through, first of all, if you're eligible, and second of all, how to get that appointment. We continue to have limited vaccine coming into Eau Claire County, but there are increasingly available appointments. So please continue to check and really reach out to those providers of appointments when you're able to. If you make an appointment with any of the providers in Eau Claire County, please show up. We are increasingly having people that don't show up for appointments, and that does create challenges because once we open those vials of COVID-19 vaccine, we need to give them. And if we have a lot of no-shows, it does create challenges. So please make an appointment, show up for your appointment. We do have all 3 types of vaccine that will be available in Eau Claire County. I do want to share that as an update that starting this week, we will have Johnson & Johnson available. Again, targeted for our educator group as part of the state plan to get to educators, but certainly will be available well beyond educators as we get through our populations that are currently eligible for COVID-19. So do know that the single dose vaccine is available now coming up starting this weekend in Eau Claire, as well as all of the vaccine, Moderna and Pfizer that previously was available. Again, all vaccine types are working. Please, whatever vaccine you have presented to you, please take it. That is the best vaccine, is the one that you have an appointment for. All of them are effective. All of them will make a difference in how quickly we can get back to having life in a more normal way. And we all want that. So please make sure you get an appointment, you keep your appointment, and do know that all vaccine right now that is available is vaccine that will help prevent death related to COVID-19, which is our goal. A couple of numbers related to vaccination. We are now at 36,133 total doses of COVID-19 given to Eau Claire County residents, which is just astounding when you think about it in these short number of months. We have 22,673 people that have gotten at least 1 dose of a vaccine. Those are all individuals that need a second dose for the most part because Johnson & Johnson hasn't been available in this community. But that does mean that almost 22% of people in Eau Claire County have received a vaccine as a starting point. We have about 13% of our population that have completed their series for COVID-19. And we are at 70% of our 65 and older population that's gotten at least 1 dose. Again, a highly prioritized population in preventing the negative outcomes that we are all looking for related to vaccination. So good news, our vaccination rates are going up. We have strong vaccine provider availability. We just need more vaccine in Eau Claire County, and we're hopeful that that will be coming soon. And we're seeing lower disease rates. We need that to continue. Our ask of the community is to do those basic things that will continue to keep disease spread slow. Keep your circle small. Really make sure that you are doing things that are not creating conditions that put you or others at risk. So wear your mask when you're out in public. Make sure that if you are sick, get a test and stay home. And keep distance from those that are not part of your family as much as you're able to do. So a couple questions from media came in advance, and I'll walk through those, and then I'll ask Audrey to share any additional questions. First of all, how many people are getting vaccinated per day or per week on average, and is that going up or down? On our website, you can see those daily vaccination rates for our county, as well as the state as a whole. We've stayed steady around 4,500 or so vaccines a day happening for Eau Claire County residents, which is good news. We are hoping that that soon goes up. Our county is doing really well. There are surrounding counties that are not at the same place for the percent of the population vaccinated, and appropriately, we need more vaccine to go to those places so we have equal opportunity across the state for people to get vaccinated. But we know the supply will be coming and increasing here. So we hope to see that increasing. The state announced to local health officers during our 2:00 call today that they expect by as soon as the end of March, early April, for the vaccine supply to be significantly increasing nationally. So we are hoping that our vaccine availability does increase in Eau Claire County significantly. The next question is, are we ready for more vaccine when it becomes available? Absolutely. Not only is the health department ready to do that, but our vaccine partners across Eau Claire County are. This week, we are increasing the number of vaccine clinics, for example, that our health department is doing. So we are moving beyond the North High School clinic that we have done for mass vaccination, and we're doing this week additional clinics in Fall Creek, and we will do clinics at Memorial High School as well because of increased allocation of vaccine through that Johnson & Johnson program. We are ready to do that locally as a health department, and our providers are every week asking for more vaccine than they are receiving. So we know they are also able to do additional vaccination when and if the vaccine becomes available. We additionally were asked a question about, will COVID vaccination clinics become as common as flu clinics? Again, we are very early into this, but certainly our communicable disease experts across the nation are considering that COVID-19 might, similar to influenza, be something that we regularly have to receive. A pandemic like this has not happened in many, many, many years. It is something that we will be learning as we move forward to see if we do need something like an annual vaccination that likely would roll out in our usual ways, like the annual flu vaccination program does now. So we'll learn a lot, and we will certainly keep people posted as we learn that. We also got a general question about whether we're optimistic about the future when it comes to COVID. Yes, absolutely. Our community has worked hard together for more than a year now. Businesses, schools, healthcare, all the partners have been working hard together to keep our case numbers as low as possible, to keep the people that are Eau Claire County residents as low as possible that have died or been hospitalized. We've come together, we've learned a lot, and we are now vaccinating. And I think the fact that we know a lot about how to slow down spread by keeping distance, wearing a mask, doing the testing that we're doing, and we're vaccinating now is really hopeful and good news. So an additional question about vaccine is, does the health department anticipate any problems when vaccine distribution when the state opens up eligibility to the 2 million people in a couple of weeks? I already shared with you that it is going to be a challenge. There are many, many people in Eau Claire County that will be eligible, and we likely at the end of March will not have sufficient vaccine for all of those individuals. Again, we ask for people's patience. The state has asked us already to start considering ways to prioritize and to ask healthcare and other providers to prioritize. That includes strategies such as individuals that are of an older age and have one of these conditions, or individuals that have multiple compromising conditions, that they would be prioritized first. So there certainly will be likely having to be strategies employed by vaccinators across our community to do that. Not everybody will get vaccinated right away. And again, do know that vaccinators in this county are working hard to, as quickly as possible, get every vaccine dose in arms as we can. We were also asked, related to this newest eligible group, about whether or not people would be required to show a doctor's note or documented proof that they meet the eligibility criteria for those conditions that make them eligible. Many people, again, will be eligible. We will not, in Eau Claire County, be requiring any kind of doctor's note or doctor's permission to get vaccinated because of those conditions. We will be having the same sort of attestation process, which is really a simple statement that, yes, I have one of these conditions, and yes, I meet the eligibility requirement. The privacy and confidentiality issues related to sharing what your health condition is are not things that we will be taking on in our mass vaccination clinic. Those people that have a regular doctor that are being treated for any of these conditions will be reached out to by their healthcare providers, and we strongly encourage them to seek their COVID-19 vaccination through their healthcare provider. They want to maintain that connection for those individuals that do have serious health conditions, and it's an important way to continue that relationship with your healthcare provider. So please do plan on interacting with your healthcare provider if you have one of these conditions to obtain your vaccination. So the final question, I believe, is related to St. Patrick's Day, and I'll walk through that. Certainly, we have spring coming, and that includes many holidays, including St. Patrick's Day and Easter and Passover for some individuals. It also includes time when people like to start getting together outside. Through the Economic Recovery Task Force in the Chippewa Valley, as well as through Health Department connections, we have been doing a lot of outreach related to events and gatherings that are likely happening in the next several weeks and months. There are better ways to do those gatherings, better ways to celebrate, and those have been clearly identified across our community, and we're counting on people following those better practices. We did send out guidance to our businesses that are bars and restaurants in Eau Claire County to really talk through St. Patrick's Day, for example, and think through some specific things that they can do to make sure things are safer in those environments. We hope people make choices to not go to large gatherings. That is one of the ways that COVID-19 is spread. And with the variant strain of COVID-19, we strongly encourage you to keep your gatherings small for whatever celebrations you have ahead. The same mitigation strategies are ones that we will continue to have for some time. We don't have enough of our population vaccinated, and we do have variant strains of COVID-19 that we are still tracking and seeing outbreaks in other places of the world that we need to pay attention to. Our message to the community, as well as to our businesses, is don't gather in large groups or crowded areas. Same message. Wear a mask in public. The same message. Keep distance. Stay home if you're sick, and wash your hands. There's lots of ways to celebrate. We hope people find, again, creative ways to do that. If you're choosing gatherings that may put you more at risk, please consider making sure that you don't expose people that potentially are in more compromising conditions because of your situation. Please consider getting tested. We really hope that those people in our community really think about one another and think about the businesses and schools that are desperately trying to stay open. We need to keep our case numbers as low as possible. Again, if people need more information, please go to our website, covid19eauclaire.org, or call our call center hotline. That number is 715-831-7425. So Audrey, do we have any additional questions?
No questions in the chat. Is there anyone online from our media who would like to unmute and ask any additional or follow-up questions?
Excuse me. All right. Sounds like, go
Can you
ahead.
can you hear me all right?
I can now.
Okay. Thanks for this. And you've already touched on this, but I was wondering if you could get into any more specifics about guidelines or recommendations to local establishments regarding St. Patrick's Day, because, there was a coalition letter that was sent out in Menominee to establishments.
Yeah, we sent an email out to all establishments, really asking them to keep their numbers small. Our current expectations document does say 50% capacity, and that remains as the expectation in Eau Claire County, that those establishments retain that threshold for numbers of people in their establishment. So a strong reminder about that 50% capacity, a strong reminder about all of those ways that they can create conditions within their establishment to not have large groups be together. So the way they set their tables, the way they keep households in distanced arrangements, and how they really reinforce wearing masks whenever possible were included as part of our work with our establishments in Eau Claire County. Our goal is to make sure that people have opportunities to celebrate, but again, in ways that will look different again this St. Patrick's Day because of COVID-19 spread that continues to happen in this community. Are there any other questions?
Hey, Lisa, it's Max Cotton with WEAU. I may have missed this earlier, but the state DHS, when they spoke about the new vaccine eligibility guidelines, said that because so many people will be eligible, that providers may have to set sub-eligibility criteria on their own. For the health department vaccine clinics, will you guys have any specific extra criteria that people have to meet right after the 29th to get their shots, or will anybody eligible under those new guidelines be able to sign up?
Sure. So as I said a little bit earlier, we found out about this update of eligible groups this afternoon, the same time everybody else did. Our health department clinics, we have not had the conversation yet about any specific eligibility additions because of limited vaccine. Right now, the health department clinics are focused on childcare, K-12 education, as well as the other educators that have been prioritized by the state. So those are the existing groups right now. Our priority will be continuing to get through those existing groups as well as adding those highest priority new groups after March 29th. It will be entirely dependent on vaccine, and we certainly will be having those conversations not only with our health department but across all the vaccinator groups in Eau Claire County. We meet with them regularly and we talk through those types of things. And again, based on how much vaccine we receive, it may or may not be necessary to further prioritize within that group. We'll certainly be letting people know as those kinds of decisions are made. Any additional questions? All right. Thank you very much for joining us. We appreciate the time. Do know we will be back next week. We are starting again, and we've done this in the past, meeting with some of our healthcare experts and having them join our time with you. We are anticipating next week to have leadership from Prevea joining us to do some updates from healthcare perspective, as well as the usual public health updates. So you can anticipate that for next week as well. Again, thank you for joining us. We'll see you next week, Thursday.